Hey, hi students, welcome back. This is the fourth recording for Unit 8, focusing on the treatment of psychological disorders. So now we're going to move into the realm of biological therapies. So these are treatments that reduce or eliminate the symptoms of a psychological disorder by altering biological functions. So the treatments are designed to restore normal functioning. And so one of the forms of biological therapy is drug therapy or psychotherapy. So this is where a person receives a treatment which is a substance other than food, and this substance is used to, whatever it is used to prevent, diagnose, treat psychological disorders, or simply reduce the symptoms of that abnormal condition. So there are two other biological therapies that we're going to look at in more detail. One is electroconvulsive therapy and the other is psychosurgery. Now, we could mention also that people have used medicinal herbs to treat emotional distress since ancient times. And so, for example, lavender, though the evidence is not conclusive, there is some indication that lavender can be taken orally, and it has been shown to reduce some symptoms of anxiety. However, it's important to also know that the data is limited. It's not conclusive, and there are secondary symptoms such as upset stomach and headaches that also accompany the oral consumption of lavender. Now, we're going to look at two other forms of biological therapy. One is electroconvulsive therapy. So this is also called shock therapy, and it's usually employed to treat severe depression. And it does so by, the goal is to administer a small electric current that produces a seizure in the brain. And this is typically given to individuals suffering from major depressive disorder who have not been responsive to other treatments like psychopharmaceutical treatments like drug therapy or psychotherapy. So for this treatment, the person is given an anesthetic, they're given a muscle relaxer. So the goal is for the person to just sleep through the entire procedure so that they experience little to no discomfort. But there are possible side effects which have been reported as memory loss and other cognitive impairments. So inability to direct attention, inability to sustain attention is also another side effect of this treatment. Okay, and more recently, practitioners have started to implant electrodes in the brain to alter the brain's electrical activity. And this is through a procedure known as deep brain stimulation. Okay, so deep brain stimulation is administered in very precise locations of the brain. And it was first used to treat the disabling condition, the neurological symptoms of Parkinson's disease. So some of the neurological symptoms of Parkinson's disease include tremor, rigidity, stiffness, and when those symptoms cannot be adequately controlled with medication, deep brain stimulation has been used as a treatment. Okay, so the electrode begins to emit single and small impulses of electricity, and these are given to areas of the brain that control movement. And by administering this artificial level of electricity, the neurons are going to start releasing the neurotransmitters that are important for regulating normal functioning for those symptoms that the patient is showing. Okay. Now there are side effects. There has been decline in memory. So the deep brain stimulation again involves administering a small impulse of electricity in parts of the brain that are important for regulating the symptoms that the patient is showing and through that electrical stimulation, the abnormal nerve signals that underlie the symptoms are going to be restored, and so the patient can start releasing, the patient's brain is going to start releasing some of the neurotransmitter important for normal functioning. So now we're going to look at psychosurgery. So this is a biological intervention that involves the removal or destruction of brain tissue to improve the individual's adjustment. Okay, so one form of psychotherapy that took hold in the 20th century was a prefrontal lobotomy. So this is a surgical procedure in which an instrument was inserted in the brain and rotated in order to sever the fibers that connect the frontal lobe to the limbic system. And so thousands of these surgeries were performed between the 1930s and the 1950s. And some individuals were cured, but others remained in a vegetative state. And so these surgeries are no longer performed. They're it was a barbaric type of intervention. Okay. And now psychosurgery is again a last resort. It may be performed for very severe conditions like obsessive compulsive disorder, major depression, or bipolar disorder. And it involves very specific, very targeted and discrete lesions in the amygdala. So the amygdala is important for emotional regulation, or another part of the limbic system. Okay, so the limbic system, again, as a whole, is important for emotional regulation and motivation. Okay, 1 second, please. Okay, so now we're going to look at specific pharmaceutical drugs that are used for the treatment of psychological disorders. The first class being anti-anxiety drugs. So anti-anxiety drugs are also known as tranquilizers. They make an individual calmer and less excitable, doing so by suppressing nervous system activity. So they reduce overall levels of arousal and by way of inducing relaxation and inducing calmness in the individual. Okay, so as a whole, anti-anxiety drugs are known as tranquilizers because they function by reducing nervous system activity. They are neural system suppressants. And so they suppress levels of body arousal, levels of nervous system activity. And more specifically, anti-anxiety drugs are a class of drugs that are sedatives, they are hypnotic, or anxiolytic drugs. Anxiolytic meaning they dampen or reduce anxiety in the person, doing so by acting on the GABA neurotransmitter system. And so the GABA neurotransmitter system, as you know from introductory psychology, is the major inhibitory chemical in the brain. And so these are drugs that facilitate GABA neurotransmission. Okay. And so these are the most common anti-anxiety drugs. So they're very fast acting. They take effect within hours. However, they also raise the risk of addiction. So the person may become addicted to these drugs with repeated use. They're associated with loss of coordination, with drowsiness and fatigue and mental slowing, by way again of them being suppressing neural activity in the person's nervous system. And so important to note that examples of benzodiazepine are Valium, Xanax, Ativan. Those are commonly used benzodiazepines for the treatment of anxiety. Okay. Now, another class of anti-anxiety drugs is they are known as beta blockers. So beta blockers pose less of a risk of addiction compared to benzodiazepines. And these beta blockers like propranolol is also used to treat anxiety. And these are drugs that work by blocking the action of epinephrine or adrenaline. And by doing so, they reduce the symptoms of anxiety, inducing calmness and relaxation in the person. Okay, so now we're going to look at antidepressant drugs. So these are any drug, any pharmaceutical agent that is administered for the treatment of depression. So one class or category of antidepressants are tricyclics. So tricyclics are believed to work by increasing the level of certain neurotransmitters, such as serotonin, norepinephrine, or dopamine. Okay, so these are chemicals that are going to have increased levels when someone uses a tricyclic antidepressant. Okay, but some of the side effects of these drugs are really the person feels restlessness, they feel faintness, trembling, sleepiness, difficulty remembering. So these are the side effects seen with the tricyclics. Monoamine oxidase inhibitors differ in their action because they work by inhibiting monoamine oxidase, which is one of the principal enzymes that metabolize or break down the neurotransmitters, such as serotonin, norepinephrine, or dopamine. Okay, so it's important to note that tricyclic antidepressants work by increasing levels of neurotransmitter availability, whereas monoamine oxidase inhibitors work by blocking the principal enzyme that metabolizes or breaks down these chemicals. And then the last one we have are selective serotonin reuptake inhibitors. And so these work by interfering with the normal reabsorption of serotonin in the brain. Okay, so that's illustrated in the graph here. You can see that normally serotonin is drawn back or travels back to the presynaptic neuron, and it's taken up into the presynaptic neuron. It's reabsorbed in order to replenish the synaptic vesicles and make it available for future release. But the selective serotonin reuptake inhibitors, they function by, such as Prozac or Paxil, they work by blocking this reuptake mechanism, increasing the availability of serotonin in the synapse so that it has a longer lasting impact on neural activity. Okay, so it increases the availability of serotonin in the synapse where it can impact neural activity and continually improve or produce emotional effects. And so serotonin reuptake inhibitors, again, work by blocking the normal reuptake mechanism that is seen with serotonin. Okay, so, but some of the side effects, again, they also have side effects. They include insomnia, anxiety, headaches, digestive problems, and also impaired sexual function. Okay, so now we're going to look at antipsychotic drugs. So antipsychotic drugs work by blocking certain neurotransmitters in the brain. They're given to treat symptoms of psychosis, such as hallucinations and delusions. And again, just to go back to the content from chapter 7, from unit 7, recall that, just as a reminder, that psychosis is that mental state that's characterized by a loss of contact with reality, and the person in that state experiences hallucinations and delusions. And the drugs that are given to treat psychosis are antipsychotic drugs. So these drugs often work by targeting dopamine receptors. Okay, and they're given in conditions that are marked by psychosis, especially given for those who suffer from schizophrenia. Okay, so again, dopamine is the chemical that is the target of these drugs, and these drugs work by blocking dopamine receptors in order to reduce dopamine transmission in the brain. And so these antipsychotic drugs work. They do reduce psychotic symptoms, and they also reduce motor movement disorder that is unique to schizophrenia. So the agitated behavior, they reduce tension, they decrease hallucinations, and they also produce better sleep patterns. And so these are important improvements that are seen when under the treatment of antipsychotic drugs. So they are used especially in individuals with schizophrenia. Okay. Now it's important to note that these medications do not treat or cure, I should say they do not cure schizophrenia, but rather they only treat the symptoms of schizophrenia. Work by blocking the dopamine system's action in the brain. And so the hypothesis is that individuals with schizophrenia have elevated levels of dopamine, abnormally high levels of dopamine. So these antipsychotic drugs work by reducing dopaminergic transmission. Okay, so now we're going to switch gears and look at social cultural approaches in the treatment of psychological disorders. So the emphasis for social cultural approaches is viewing the individual as part of a system of relationships. So the person cannot be conceptualized or viewed as operating in isolation. All individuals are social creatures, and we operate in the context of multiple relationships, and we come to play different roles in our lives and occupy different places within multiple relationships. Okay, so it's a perspective that puts strong emphasis on the system of relationships that the person is embedded in, and looking at psychological problems from that perspective, and looking at ways to provide treatment that addresses the person's place in a system of relationships. So, okay, so now when we talk about the social cultural approaches, these are approaches that accord importance and value to social or cultural factors as being influential in a person's psychological functioning. So it's important to take those into account. So the type of society that the person lives in, what important societal roles they occupy, what gender are the person, their gender, their age, their ethnic background. All these are factors that are going to be influential, and it uses certain approaches that include the dynamics, the group dynamic, in order to explore the variables that are unique to a group setting. And so those are embedded in the therapeutic treatment. And I'll give some examples where this becomes more tangible or more practical. So we're going to look at a first form of social cultural therapy, which is group therapy. So in traditional therapy, there's one therapist in treatment with one client. So the therapist is providing treatment to one client. In group therapy, however, there are one or more psychologists, and they lead a group of approximately 5 to 15 patients. Okay, so that's the group therapy setting. And so these individuals share a common disorder. The patients are, what the patients have in common is that they share the condition or the disorder for which they're receiving treatment. And so in that setting, the professional is facilitating the sessions. And the sessions are going to involve some psychoeducation. So there's going to be information about the condition that the patients are receiving treatment for. And there's also going to be some dynamics, group dynamics are going to facilitate some of the imparting of that information. So we'll look at the 6 features that characterize group therapy. And group therapy is a very appealing model because there's good reason to believe that individuals who share psychological disorder may feel empowered. They may benefit from the empowering effect of observing others cope with the same disorder, and also they may benefit from the empowering effect of helping others cope. So there's some observational learning that is happening in a group therapy setting where someone may learn from another member of the group how to better cope with a shared situation or shared condition. And they may also help someone else cope, which is also gives and provides a sense of empowerment to that person who is helping them. Okay, so let's look at the 6 features. The first one is information. So this describes the imparting of information. So there's some sharing, there's imparting of information. And so the therapist or therapists are educating, and they're providing some psychoeducation that empowers the group members with the knowledge pertaining to their specific situation or their specific condition. So this could be one form of information. Information also comes through the sharing of personal experiences. So a group member may share with others how they've dealt with certain difficulties and how they've experienced success by dealing with those difficulties. So that's first feature. Second feature is universality. So this describes the patients or clients realizing that others in the group also share the same feelings and problems. Okay? Then that's universality. Coming to the realization that there are others who share the same feelings and problems. Then we have altruism. So in altruism, the group members experience a sense of significance and value by helping others that are also in the group, so helping other group members. So there's something of value when someone comes to recognize that they have something valuable to provide to a fellow group member. Okay, so they experience gains in self-worth, and they also experience gains in confidence. Then we have experience of a positive family group or group cohesiveness. So this is the sense of belonging, the sense of acceptance that provide a member with both a nurturing and an empowering experience. So the person feels a sense of security in that group setting, that it's safe. They feel safe in the group setting. They feel a sense of belonging. They feel accepted for who they are. They feel that they bring a value and they experience the value of others. So then this is an important catalyst to take the risk and self-disclose and change. So self-disclosure is an impetus for change, for personal change. And as individuals, we may be reluctant to self-disclose. We're afraid for some reason that maybe others may not find the information interesting, or they may feel that it's not sufficient information to disclose, or something we may judge ourselves, and that may be a roadblock to that self-disclosure. But that self-disclosure is an impetus to change. And so that's why in the group setting can facilitate that self-disclosure. And then we have development of social skills. So this encourages and advances the person related to their personal social skills, because they are going to learn they're going to need to demonstrate tolerance. So if some other group member is expressing a different opinion, they're going to have to learn to tolerate that, to accept that. So there's going to be the need to develop a skill for that, as well as a skill for setting boundaries and respecting boundaries, as well a skill for empathy and also for conflict resolution. That's important too. Okay. So being in a group setting does help reduce this isolation that someone may be prone to seek. So individuals, sometimes we seek to isolate from others. For whatever reason, it may seem safer to us to isolate from others. But this, having a secure space within the group space, feeling security within the group space enough to self-disclose, is going to reduce the tendency for isolation. And it's going to promote connection with others in more meaningful ways. And these seeking to establish authentic, meaning connections with others in the group setting is something that may generalize over time into one's life outside of the group. And finally, the sixth feature is interpersonal learning. So here the person is given the opportunity to learn about relationships and intimacy, and this is going to help them develop supportive, authentic interpersonal relationships with others. So within the setting, or within the safety of the group space, they learn some of that authentic sharing with others, and they learn to share and communicate with others. And in return, they receive respectful and supportive feedback from others, and this may be the first time that they ever receive such feedback. Okay, so now we're going to look at another form of social cultural therapy, which is family and couples therapy. So family therapy is a form of group therapy, but instead of having individuals who are not biologically related, here we have all members being of the same family. And couples therapy is also group therapy, but it's with married or unmarried couples who experience problems within the relationship. The techniques that are used, the first one is validation. So in validation, the therapist acknowledges and validates the feelings and the feelings that a person may have experienced within the family dynamics. So each family member can feel that they are being heard. So this fosters a sense of being heard and being understood. So validation is important, to validate, to acknowledge and validate the feelings and experiences that individual family members may bring to the therapeutic setting. Okay. And then reframing is also another important counseling technique, and it provides an alternative perspective than the one the person brings to the therapeutic setting. So this relates to the perceptions that individuals bring into group counseling, and there might be a constructive reframe. The person may be viewing something from a very limiting perspective, and this reframing can help them broaden their perspective so they can understand that there are other ways of understanding what was experienced in a way that is constructive. And by having it, by reframing the experience, instead of having a tendency to blame one or many individuals of the family, it could be explored from a collaborative mindset. So when there's reframing, that can be established as a family in a group therapy setting, then the family can work to collaboratively to deal with the problem. So the techniques that we've looked at so far. We've looked at validation and reframing. All these are based on the concept that individuals are deeply influenced by the dynamics within the familial systems, and this is a framework that recognizes that the patterns of behavior and communication within a familial system affect individuals on a personal level, on an individual level. So it affects members of the family on an individual level, and it affects their emotional and mental health. So let's just reiterate what reframing involves as a technique. So in family therapy, the reframing is inviting the members to view their problems from an alternative perspective. So this is a way of labeling the issues that they encounter in different ways, and often it could be in positive ways, giving positive meaning to the situations that are presented in therapy in order to deal with them collaboratively. Instead of blaming individual members, when there's reframing, there's an opportunity to deal with the issues presented in a collaborative manner. And the last technique, there's structural change. So structural change involves modifying the behavior, the individual's behavior in a way, again, that is positive, can support the familial dynamic, and it could also be modifying the behavior of multiple members of a family. So there's a structural change in order to induce a change in familial dynamic in the family. And finally, we have detriangulation. So detriangulation stems from Bowenian therapy. Dr. Bowen was a famous psychotherapist who talked about triangulation. So triangulation describes how it's a situation in which two constituents of a family are in conflict, and they attempt to draw in a third member of the family in order to reduce the tension that exists between these two individuals. So a person can be triangulated. They can be included in triangulation if, let's say, it's a child that is triangulated between the mother and the father to reduce the tension between them. So there may be a triangulation that the therapist identifies in the context of family therapy and goes through some techniques in order to raise the person's awareness that there may be some triangulation happening in the family, and to reduce that triangulation, so for there to be detriangulation. Okay, so we talked about that.